I'm Dr. Rick Buck, and I've been a dentist for 17 years. Subscribe if you have teeth. In this video, we will show you before and after and during footage of dental implants, including the good, okay, and bad result. I will show you before and afters of single tooth implants, implant bridges, and full mouth implants, one tooth implants. Let's start with a really good example of what to expect. This patient had a tooth with a discolored crown, and that tooth also had an abscess, and it needed to be extracted. So I take out the tooth, and they leave with the tooth out, a bone graft, and a membrane in place. After 3.5 months, this is what it looks like, healed up and ready for an implant. Now, here at the end of the implant procedure, this is how it looks. And after 3.5 months with the implant integrated into the bone, this is what it looks like now. We then attach a crown to the implant, and you can see it looks really, really nice, especially compared to before. Then about a year after, it still looks good. It looks like a tooth and the gums form nicely around it. Now let's go on to the next example and show you one that wasn't ideal. This patient was missing a tooth in this spot and had a lot of bone loss to where this implant was supposed to go. So I warned him that the final crown would not look that great unless he had extensive bone grafting done, likely to be done by the oral surgeon, and that would add extra cost and months of extra time to the procedure. He didn't want to do that, so I said I would do my best. So the day we placed the implants, we placed this white thing in there to save space for access to the implant. When we take that piece out, here is what the uncovered implant looks like. And here's what it looks like when we have the crown delivered. The patient has pretty yellow teeth from a lifetime of smoking, and he wanted this crown to be whiter in case he ever whitened his teeth. So this final tooth, yes, it is whiter than the rest of his teeth. You can see we stained the bottom part of the implant crown pink, and that's to match his gums. Otherwise, this tooth would have looked really long. Then a few months later, you can see the gums really tightened up around it, and it matches really well. Here is what this looks like years later now. A little bit of recession around the crown, but it still looks good. If you do things right, this is about as bad of results as you're gonna get. Here's another one with good results. This tooth also is infected, and you can see how it causes some puffy gums. The before crown doesn't look too bad, but regardless, it is infected. What is different about this patient is she didn't want to go without a tooth during the months that it takes to get the crown after the extraction and bone graft. After the extraction, we put in what we call a stay plate. It's a temporary removable option, and it clasps on to the other teeth to hold it in place. There are a few options like this, but for her, we chose this. It looks better than not having a tooth, but it's an extra cost. This is what the socket and graft looks like 6 days later. It still looks raw and uncovered. So we put in the implant, and you can watch all my videos on placing implants, and this is what it looks like as she leaves. And then now is what it looks like a week or so after the implant goes in. And now 3.5 months after the implant goes in, the gums are growing nicely around the implant. And now here is what it looks like after we put the final crown in. To me, it looks better than the crown on the tooth in front of it and the natural tooth behind it. You can see it matches the natural tooth, 2 teeth in front of it, really well. Quickly, before I get to the most interesting part, I developed the best toothbrush, floss, and other dental products that are in Amazon affiliate links in the description. Those dental products will give you a stunningly clean mouth. You should watch my videos about why they are the best, posted at the end of this video, so you brush and floss with superior results. The most difficult part of getting the cosmetics of single crown implants are getting the gums right. This is especially difficult when 2 implants are done right next to each other. I don't have good before shots of this patient, but here are 2 implants as the gums have healed around them. And now here both of them are uncovered. The different colors of the implants are for the different sizes. Lastly, here's a shot of the crowns. The gums are a little off, but they look just like the teeth in front of them. I'd say while the patient has very yellow teeth, they match his natural teeth pretty well. front teeth. Now let's go to a few front teeth implants. Front teeth are much more difficult to get cosmetic. There is a long way and a short way to do implants. I do almost all the back teeth the long way, but I do the front teeth mostly the short way, but sometimes the long way as well. This one, I had to do the front tooth the long way, unfortunately, and so I needed to grow a bunch of bone before I can put this in. You can watch the full video on this if you want to see more. The upper left canine was infected and needed to come out, so we took it out and put in a graft, a special membrane, Teflon, to seal it all off. To temporarily replace the tooth, I made a clear retainer that looks like Invisalign, and I add a white filling in it so it looks like it's just a tooth that's been replaced and sitting in Invisalign. 2 weeks later, the patient comes in, I remove the Teflon, and you can see the gums are growing over that membrane protection of the bone graft. Now, 3.5 months later, this is what the healed bone looks like. It is thicker than the bone was previously, actually. It's a little red still, but that'll go away over the following months and year. We then put in the implant and cover it up completely with the gums. All the while, the patient still wears the temporary retainer with the tooth. Now here is what the gums look like 3.5 months after the implant. We open up the gums and take a scan of the implant location. He leaves with the temporary crown attached to the implant. So you can see the gums are raw, but it looks really good. Now after all this heals a few days, this is what it looks like. It's important to know this is what the temporary would have looked like the whole time if the infection hadn't destroyed too much bone, and I could have done it the short way. And now finally, this is what it looks like at the very end. If I would have done veneers on all the front teeth, I would have made it look like a Hollywood smile. Okay, this person before had a normal bridge, and you can see it has a big piece of porcelain broken off the teeth that is holding this bridge that is infected into place. And in fact, if I press on the front tooth, you can kind of see the pus seeping out. I actually have to extract both teeth that are holding in this bridge, and I put a graft into both the spots. Here are the gums 3 weeks later, and here's what it looks like 3 months after the extractions. Here's what things look like at the end of the appointment on the day the implants go in. And now here are the implants after being integrated with the bone for 3 months, and how they look when we uncover the implants and take off the healing caps. Lastly, we put in these scan bodies to scan the location of the implants. Lastly, here is the implant bridge in the mouth. The bridge looks great. It's hard to get something really cosmetic when the rest of the teeth are not very aesthetic. Full mouth implants. If you see a lot of before and after videos of implants, it was before and after of full fixed hybrid dentures or single implants with a bunch of veneers. So I actually wanted to show you what implants look like by themselves, because that is what most people get when they have implants done. Here is a full mouth of implants I did. Here I converted his old snap-on dentures into fixed hybrid dentures. And here's what the mouth looks like with the dentures in. And those are the buttons attached to the implants that the dentures snap onto. Now here's the final after I convert these implants into a full arch of a fixed bridge, also known as a hybrid denture. Now this prosthetic does not come out and is very cosmetic. You can watch my video on how I did this on my channel. This next implant patient is another fixed full upper and lower denture, sometimes called All-On-4 bridge, meaning the whole arch of teeth goes on 4 implants. Now, they are sometimes done on 5 or 6 implants, so instead of calling them All-On-4, nowadays they call them All-On-X. But you can see his before teeth are pretty hopeless and not cosmetic. So we scan his mouth and digitally plan out what we're going to do. Then the day of the extractions, we put in implants and 2 temporary All-On-X bridges for the top and bottom. Sometimes you'll hear about teeth in a day, and this is what is meant. You have a solid cosmetic temporary option as the teeth heal. Then from those models and scans, we get a test drive, so with small changes, we can make a final denture and impression just the way we want them to look. And you can see quite a difference between the two. Here's another one I did. Actually, it was one of the first ones I had ever done. It turned out really nice, as they always do, and the patient loved them. The results with these are always quite dramatic, as you can see. As I tell all my patients, if you are patient, we will get the results really close, if not exactly to your expectations. Sometimes it just takes adjustments. So as long as your dentist and yourself aren't in a hurry to finish, you will get a great final result. And that is what you can expect with an implant, both after and during the procedure. I hope that gives you a good idea. Results will always vary, but you will get something awesome. Watch all my daily tooth care videos I have posted now for the best techniques, tips, and products for a stunningly clean mouth that avoids tooth decay and gum disease and gives you fresh breath. My dental products are in Amazon affiliate links in the description below, and if in Southern California, my dental office is in the description as well. Like and subscribe to my channel if you have teeth.